the silent struggle of pelvic health disorders. It's time we talk about something that affects millions of women around the world, but is often brushed aside as taboo or too uncomfortable to discuss. I'm talking about pelvic health disorders. Yes, pelvic health disorders. These are the silent struggles that so many women endure. Chronic pelvic pain, pelvic organ prolapse, endometriosis, and yet we rarely hear about them in our conversations, in our media, or even in our healthcare settings. Why is that? Why are we still living in a world where these issues are shrouded in silence and stigma? Let's start with pelvic pain. It's one of the most common complaints that women have, yet so many of us suffer in silence. Picture this. You're going about your day, and suddenly, you're hit with a wave of pain that makes it hard to function. It could be mild discomfort, or it could be excruciating. The truth is, pelvic pain can stem from a variety of causes: menstrual cramps, infections, or conditions like endometriosis or pelvic inflammatory disease. But often the root cause remains a mystery, and that's frustrating. It's disheartening to go to a doctor, seeking answers, only to be told that your pain is in your head, or just part of being a woman. Imagine living with chronic pain, day in and day out, and feeling like no one truly understands what you're going through. It can lead to feelings of isolation, anxiety, and even depression. You might find yourself avoiding activities you once loved, exercise, social gatherings, even work, because the pain is just too much. It's not just a physical burden. It's an emotional and psychological one too. And the silence surrounding pelvic pain only amplifies that struggle. Now, let's talk about pelvic organ prolapse. This condition occurs when the pelvic organs, like the bladder or uterus, sag from their normal position and press against the vaginal wall. For many women, this can lead to symptoms like urinary incontinence, pressure in the pelvic area, or the sensation of something falling out. Yet, despite the fact that pelvic organ prolapse affects a significant number of women, it's still rarely discussed. The stigma surrounding it often comes from outdated notions about aging, childbirth, and femininity. Women may feel embarrassed to talk about something that affects their basic bodily functions. Can you imagine feeling like you can't talk to your friends or even your doctor about what you're experiencing? The shame and embarrassment can be overwhelming. Many women suffer in silence for years, thinking they're alone in this struggle. The emotional toll is heavy. Feelings of shame, diminished self-worth, and a loss of intimacy can creep in, making it even harder to seek help. And then there's endometriosis, a condition that affects approximately 1 in 10 women of reproductive age. It's a chronic condition where tissue similar to the lining of the uterus grows outside the uterus, leading to severe pain, heavy bleeding, and even infertility. The symptoms can vary widely. Some women may experience debilitating pain, while others may not even realize they have the condition until they struggle to conceive. It's shocking that, on average, it takes about 7 to 10 years for a woman to receive a proper diagnosis. Can you believe that? Years of suffering, often dismissed or minimized by healthcare providers who fail to recognize the seriousness of the condition. The pain associated with endometriosis is often described as excruciating. Yet, many women are told to simply learn to live with it. This lack of validation can leave them feeling frustrated and hopeless. And when it comes to fertility, the emotional toll is even greater. The grief and loss that accompany the struggle to conceive can be overwhelming, especially when compounded by the physical pain and discomfort of the condition. But let's take a step back and consider the bigger picture here. Why is there so much social silence surrounding these disorders? Why are we still living in a world where women feel ashamed to discuss their health issues? The stigma is deeply rooted in societal taboos around menstruation, sexuality, and the female body. Menstruation has long been a source of shame, and this stigma extends to conditions like endometriosis, which disrupt a woman's ability to function in daily life. Many women feel that they can't talk openly about their struggles because they fear judgment or misunderstanding. They worry that discussing pelvic organ prolapse will make them seem less feminine, or that sharing their experience with endometriosis will be met with eye rolls or dismissive comments. This silence only reinforces the stigma, making it harder for women to seek help and support. And let's not forget about the healthcare system itself. Many women report feeling dismissed or unheard by their doctors when they bring up pelvic pain or other related symptoms. This lack of understanding and empathy can discourage women from seeking care or even getting a second opinion. It's no wonder that so many women feel isolated in their struggles. So, what can we do about this? It's time to break the silence surrounding pelvic health disorders. We need to talk openly about these conditions, raise awareness, and reduce the stigma. Women should feel empowered to speak up about their health concerns, whether it's pelvic pain, prolapse, or endometriosis. By fostering a culture of understanding and compassion, we can create an environment where women feel heard and validated. Advocacy is also crucial. We need to push for better healthcare and more research into pelvic health disorders. Many conditions, like endometriosis, are under-researched and underfunded, which limits treatment options and support resources. By advocating for increased funding for research and better diagnostic tools, we can improve outcomes for women suffering from these disorders. And let's not underestimate the power of community. Women who are experiencing pelvic health issues need access to support groups and communities where they can connect with others who understand their struggles. Online forums, social media groups, and local support networks can provide a safe space for women to share their experiences, offer advice, and find solidarity. These connections can help reduce feelings of isolation and shame. Breaking the silence is not just a call to action, it's a necessity. The struggle of women with pelvic health disorders is real, and it's time we acknowledge that. By talking openly about these issues, we can create a more supportive and understanding environment for women everywhere. We must advocate for better healthcare, more research, and a society that no longer shames women for their bodily experiences. If you're struggling with pelvic health issues, remember that you are not alone. Don't be afraid to speak up, seek help, and reach out for support. Your health matters, and you deserve the care, attention, and respect that every woman deserves. Together, we can break the silence and create a world where pelvic health is no longer a taboo, and women's voices are heard, validated, and empowered. Let's lift each other up, share our stories, and change the narrative around pelvic health for good.